the federal government does not manage health insurance. It's literally state by state with your Department of Insurance. And so every state is different. And it's from my standpoint, surgery is very easy in the sense that you do the same thing over and over and over again, and you make micro improvements to get better.
Mm-hmm.
In health insurance, it varies. I mean, in Oklahoma, you have different laws than what you do in Texas, and depending on who's running the state, whether it's a Republican, a Democrat, an independent, it doesn't matter, right? Then you got their Department of Insurance in there, and then so it's amazing, just everybody's agendas and manipulating this and that, and it's just, and unfortunately, it doesn't ever seem that we as the consumers are ever at the top of their list of taking care of what needs to get taken care of, right?
So how has that knowledge, your own personal knowledge and what you just explained so very concisely, Shane, how has that shaped you as a CEO and what you're doing right now that you see it, and of course we're all consumers of healthcare, but you understand the challenges for your customers. So how do you let that shape what you're doing right now?
Really one word, empathy. And so you really fight for, our clients, and we, everything we do, we're different in the sense that we built our own provider network that has a $25 copay with no balance bill. And so we really turned the industry on its ear by doing, because everybody told us you can't do that, and we did it. And so we wanted our members to be able to go see a doctor and pay the $25 and really reduce that barrier, right? When you look at what happens today with an ACA qualified plan, and they have a $5,000, $6,000, you see $8,500 deductible, they're functionally uninsured, right? They cannot afford to go see a doctor. And so when they go see a doctor, so let's say they go to an urgent care, right? Urgent care has transparent pricing. They're great organizations, but problem is, let's say, and I won't pick on any, but let's say you have one of the major medical plans. Well, you go in, they're contracted. Well, you have no visibility into what their contract is. So you go in to see that doctor. And even though the urgent care, let's say they have $200 for all-inclusive physician visit, lab, and whatever, right? Well, all of a sudden you get a bill for $300 and you're like, wait a second. It was you were in network with my carrier, and they're like, well, we have carve outs, and there's no transparency. And so, it's very frustrating. It doesn't make any sense, right? I mean,
well, they're supposed to, though. They're under a deadline and they're fighting back. So the former administration had a deadline, and it has not been stopped by the current administration, that all hospitals and all groups had to provide transparent pricing, and they're not. They're just
Jennifer,
refusing to do it.
Something. Do you know what a CPT code is?
Yes.
Okay. Because you were in the hell. That's right.
Yes, and I work billers and coders, I listen. They yell.
99% of Americans have no idea what a CPT code is. So if you get a price on a CPT code, which is basically what the hospitals have done for the transparency. So depending on your plan, right? If you have Blue Cross, they may pay 100% of the top 2 CPT codes, and then pay 50% of the next 2, and 0% of those. Medicare pays XYZ. Everybody pays different. So how on earth is that transparent, right? And the problem is you have bureaucrats that are saying, oh, pricing transparency. Well, let's define pricing transparency, right? And so my last company that we were at, Employer Direct, we created surgical bundles, right? So if I went in for a total knee, I paid, let's say, $25,000 for a total knee. I knew everything was included: anesthesia, implants, surgery, everything, post-op care, pre-op care, everything. Well, that's how it should be transparent, but that's not what they're doing. They're saying, oh, the CPT codes.